Gentlemen, let's move straight to our final story, where as Nigeria continues to be bombarded by challenges, another worrying development is brewing in the health sector. The Joint Health Sector Unions, JOHESU, and the Assembly of Healthcare Professionals have issued a 15-day ultimatum to the federal government to resolve the outstanding welfare issues or face a nationwide strike. After an initial planned strike was suspended following the intervention of President Bola Tinubu, the unions have announced that their members will resume their suspended strike on the 25th of October if their demands remain unmet. Some of the issues include the adjustment of the consolidated health salary structure, the extension of retirement age for health workers from 60 to 65 years, the payment of COVID-19 hazard allowance for omitted health workers, among others. All right, Asuka, I'll start with you here. The Joint Health Workers Union, they're about to embark on a strike. Now, what do you make of the 15-day ultimatum given to the federal government and the issues they raised? How credible are those issues?
I think those issues are very, very credible. It's something that I know this minister, Professor Alipati, can handle. Anytime there's an issue like this, I'm not sure the government should handle everything. It is for you to come to the round table, see the ones you can handle, see the ones you can quickly do, and then give a timeline, for the others. Okay. Because that is why we've always had this issue about people, unions going on strike and all that. They've given this ultimatum. I want to believe that the ministry officials are already sitting down, seeing what to do. Okay. I'm even surprised about this payment of COVID-19 hazard allowance.
Yeah, the omitted workers.
Yes, so I feel that one can easily be done. Because a friend of mine who is in America was telling me during COVID how much he earned during COVID.
If you remember, during COVID, there was a time of this hazard allowance.
There was a special money for it. So abroad, if you are working during COVID, and because so many people don't go to work, health workers, you are the only ones. So if you come here, it's like you're putting your life
in danger.
So there was a special allowance for it, and it was big. It's not like this Nigeria home that they will give you.
Don't worry, we'll get there. We'll get there.
So when this particular fund should be quickly, I feel the minister should deal with that first. Immediately. Pay those ones. Then you start looking at, maybe 60 to 65. Why do they want the extension? Because if, for instance, a professor is 60 years and is still strong, or a doctor is still strong and maybe
can still perform,
maybe that is where they are looking at. The minister can look at it from that angle and say, at 65, we still need his knowledge, you still need his talent in the theater room and all that.
The brain drain.
Yeah, exactly. So people are going.
The doctors are
Let me tell you, Nigerians are going every day. Professional doctors, nurses, they are all living. So if the minister sits down, it's something that he can resolve. There are some things here, I've seen some of these demands. There are some credible things that he can quickly address and then give a timeline for others, and say, maybe in the next 2 months,
I agree, the timeline.
We can come back on the round table and begin to talk about the salary structure. The minister that I know is a listening minister, and I know he will solve this problem.
He's a listening minister, but what do you make of the 15-day ultimatum?
Well,
can we even afford to go on a strike right now to have health workers going on?
There's no doubt the fact that a healthy nation is a wealthy nation.
Sure.
And health is wealth. I want to believe, like he said, the minister, because this caliber of ministers, they are listening ones. At least they are engaging the workers. If there can be a way in which they could come to an agreement to stagger the implementation of all these demands. When they stagger it, you do this one in the first 3 months, and they make sure that they keep to their word. Because in Nigeria, Nigeria is the only country where government will sign an agreement in 2009.
Oh, you're talking about ASU.
They are yet to implement it. They should arrive at a particular agreement, stagger the implementation because of the.
Do you think the Nigerian government is abusing the idea of a dialogue?
Well, with this government, I don't
think. I think this government is even giving it.
They're even giving the opportunity for dialogue to discuss with people. So the minister should come because of the implications at a time like this. Doctors, Nigeria cannot afford the doctors. If we still have patriotic doctors who have not japa, who have not moved out of the country, nurses, doctors, and allied health workers, we should engage them and say, well, there's no money now. We can stagger the implementation. The moment you started the first one, make sure that when that one expires in 3 months' time, you start it.
In a way, I think they should be a bit patient.
They will have the confidence that at the end of the government will do it. But when you break your promise, after, as they signed an agreement 2009.
You remember that they had this matter, and the president had this conversation with them last year, and they came back to work. So, now again. Well, so that's why I'm saying that is the government abusing the idea of a dialogue
between you and me?
Yes.
The government may even have it in the plan, but the bureaucracy system in Nigeria, you'll be shocked when we get to the nitty-gritty of the matter. It may be bureaucracy. It may be the money is in the budget. Because when you look at for the fact that the benchmark for last year was probably $56.
$56, okay.
Yeah, we have more excess money. Royalty to collect, not from the NPs, because Nigerians don't know. So if you have more royalty to collect this year, let the government look at the part of it and take care of the essential workers. Those doctors that are still here with us. Because a healthy nation is a wealthy nation.
It's a wealthy nation.
We should do something about that.
We should do something about that. Babatunde Abaton, thank you so much for having this conversation on this beautiful Thursday. Asukwa James.
Thank you.